Well, welcome everyone to our Think Oral Health platform and our podcast. I am so excited to have a colleague and friend, Miguel Stanley, here. Amazing. He is in Portugal and he's had just an amazing career in dentistry and really being a forward thinker in the industry. Today, Maria Filippopo can't join us, so I'll be taking this by myself, and I'm just excited to have Miguel here. Let me start by explaining who Miguel is. He's really the visionary founder and director of the White Clinic, extremely well known in Europe. It's in Lisbon, Portugal, internationally acclaimed dental center. It's known for its excellent, and Dr. Stanley is the head there, the founder of it, with an amazing qualified team. He's had a movement called the Slow Dentistry Global Network. It's a not-for-profit organization, champions the enhancement of patient experience and safety and clinical outcomes in dental care. He holds license in UK and Dubai. He's an adjunct associate professor at the University of Pennsylvania. He's been a TEDx speaker, National Geographic documentary host, co-founder of The Missing Link, the world's first artificial intelligence that helps the medical community communicate better with dentists by means of scanning dental x-rays for hidden, silent disease and pathologies. He spends most of his time working with his team, really making a difference in the industry and transforming and improving the lives of his patients and patients around the world. Miguel, welcome to our Think Oral Health podcast.
That was very, very kind of you. Thank you so much for this invitation. First of all, I know how busy you are and how valuable a New York minute is. So thank you very much for your precious time. It's great to be with you all here today.
Oh, it's great to have you here.
And for those that don't know, I'm a big fan of John's. We go way back. We've lectured together around the world. And I'm a big fan of everything you do. Most impressed by your cycling abilities and how much energy you put into that. And again, what you've done with your Glow Foundation and the work you do with charities around the world. And also, I visited your practice in Fifth Avenue in Manhattan, and just how cool that is, and what a cool guy you are, and what a great patron of excellence that you are in dentistry, fostering amazing thinking, bringing people together. And every time I hear you speak, I learn things. And so when you invited me, I'm so thrilled to be able to talk with you. I always learn things when I speak with you, my friend. So thank you.
Well, thank you for that. And I remember the first time we met when we were with our pal Christian Coachman and a bunch of our pals. And you and I got into such a heavy-duty conversation. We had to go outside because we were bothering everybody else. And we were so excited because we are very like-minded. You are my Lisbon brother from another mother, and that's for sure. And we share so many ideas. And when we synced up recently, Miguel's work in longevity and how dentistry and oral health impacts longevity and overall health, it's amazing that you've evolved into that area similarly and a similar path for me. But let's take it from the beginning, Miguel. Let's talk about how you started in dentistry and some of the visionary work you've done as early as 2008 with this integrated approach that you had where you brought everybody together under one roof. I'd love the listeners, the dentists, the dental professionals, the DSO owners, to hear you talk about the strategies you employed, what worked, and what unfortunately came out of how big and what had, and what you might have changed if you could turn back the clock of time. What would you change? So take us down that road a little bit.
All right. So I was born in South Africa and I have a British mom, and that's why I speak English. So I moved to Portugal when I was 9 years old. My dad's Portuguese, and I grew up here. With that said, graduated in 98 and immediately went on to the Brandemark Center in Madrid and trained with Mariano Sanz and Bertil Freeberg at the Brandemark Center. So classically trained in implant surgery. And then also afterwards, the year after, in cosmetic dentistry. So from the early inception, I understood the importance of crafting beautiful smiles and of doing implant dentistry. And opened my first practice January 2000, and little bit of a history here. I already in 2000 acquired RVG, intraoral X-ray digital intraoral X-rays. So I've actually got digital files of my patients going back 24 years, which is kind of insane. So I've been an early adopter of digital technologies, a big fan. CBCT 2008. Basically, with CBCT, all of our adult patients upon first appointment. First adopters, early adopters of intraoral scanning, 3D printing. So I'm a collector of tech. I love that. But in 2004, I've always been an entrepreneur, forward thinker. And what people need to know in America is that in Portugal, very conservative country, doctors and lawyers are not allowed to do marketing. So everything has to be word of mouth, and you weren't allowed to do advertising. You weren't allowed to promote yourself, which makes it a hell of a lot more difficult. And in 2000, Portugal was one of the poorest countries in Europe. So, I mean, it's beautiful now, and I invite you all to come. Got an amazing economy. Things are booming. Beautiful beaches, restaurants, and hotels. You love it. But back then, the dark ages. And I remember setting up my first practice with what we call the Bible of Henry Schein, that thick book, like the yellow pages, and going through everything. And in my head, I need that. And there was no help. There was no internet. I mean, there was nothing. I mean, you remember what it was like. So
Right.
It was a miracle we managed to do what we did, and very grateful to early learnings from Maurice Salama, Henry Salama, David Garber, Team Atlanta, Ronald Goldstein, for creating in me back then the concept of interdisciplinary practice, hiring my first associate in 2001, my hygienist, then my orthodontist in 2002. She's been with me now for 21 years. Very grateful for that. Invisalign back in 2005. So we've been early adopters of a lot of things. And basically, I started being an interdisciplinary practitioner, understanding surgery and cosmetics. And I was doing the surgery and the restorative of my own cases. So let's call it a super GP. And that's not my own words, by the way. And that's what we talk about, in America.
The multi-specialist.
The multi-specialist, from day one. And, owning my own practice, not being able to do marketing. And so in 2004, 5, I got invited by a buddy of mine to go to the Dentsply, it wasn't Sirona yet, the Dentsply meeting in Las Vegas. And I had never been to a course in America, never been to a master meeting, and I had never been to Las Vegas. And I arrived there, I'm a kid, I'm 29 or something like that. And I'll never forget 3,000 people in an order. I'd never seen anything like this. I'm just a kid from Portugal. And Dr. Phil, to the sound of Born in the USA from Springsteen, comes on stage and motivates everybody. And I'm like, oh man, this is amazing. And I heard about Bill Dorfman and what they were doing on Extreme Makeover, the first edition of that. And I was like, hang on, plastic surgeons and dentists, and I love this. This is amazing. And a little piece of information, I paid for my university degree by doing TV commercials. So I was kind of I did a lot of TV commercials. I did 80 TV commercials between 1992 and 1998. I did for McDonald's and Coca-Cola, and so I understood how to produce stuff, and I knew TV, I knew production, directing, and all of that. But the day I got my diploma, I quit. I never did it again. But that information stayed in the back of my head. So kids, if you're watching, everything matters in your life. Everything's a learning curve. Anyway, so I met the team of plastic surgeons, not Bill. I had never met Bill until only last year. But I met the team of plastic surgeons. I'm like, tell me how it works. And they told me how it works. I'm like, I need to do that. So I found out that it was ABC and Endemol, which were the productions that actually owned the rights to Extreme Makeover, which then later became Home Edition, right, for home renovation. But the first version was on people, and I think that was one of the first times that veneers became home. People learned about veneers. Let's put it that way. Now,
Right.
Like it or leave it, that was disruptive in the industry because dentistry had never been, a syndicated thing before. So I basically wrote a TV show, myself, an idea, and I wanted it to be where we could do more than just beauty. I wanted it to be about health because the foundations, and in Portugal, remember, dentistry was it was only 25, 30 years old in 2000, 2003. So there was a lot of people with poor quality, missing teeth. Even today, Portugal, 60% of our population are missing more than 6 teeth. All right. Mm-hmm. So it's not Manhattan. It's not okay. Now, with that said, I pitched the show, and I'll never forget. The day I go to pitch the show to the chairman of this #1 network in Portugal, the guy says, "Okay, I'll buy it. I want to produce 13 shows. Let's do it." And I was like, he's like, "What do you want?" And I was like, "Oh my God, I wasn't prepared for the answer." I just said, "Look, I want absolute control of who gets on my show, right. And just from a medical perspective. So products, doctors, patients, I get the final say, not because I wanted the control, I just didn't want mistakes to happen, because let's just say I'm very focused on ethics, and I wanted ethics, and I think it's followed me my entire career. I think doctors have to be teachers, they have to be pillars of industry, not salespeople, and I really wanted to do a good job because I knew how important it was.
Miguel, when you when you presented to this show, your thesis, was it all about oral health, the
Yes.
smile, transformations, all of it?
Yes. Yeah. It was basically saying, you can't do a facelift without raising the vertical dimension. Now, I explained that in layman's expression, but it was bothering me how many people were going to do a facelift because of the wrinkles, and the plastic surgeons were not saying, "Hey, go raise your vertical dimension." No one was saying that. Yes. And I was like, hang on, I learned how to do this. Why doesn't the consumer know about this? And honestly, and we can talk about this later, but I think dentists have done a terrible job at promoting dentistry to the audience. I mean, if you speak to the millions of Americans today and people around the world and say, what's the most comprehensive, complex treatment in dentistry? Aligners, veneers. We know how important foundational dentistry is. So, and moreover, I'd learned how to do with, back in the day, Danny Boozer and all those guys, to do sinus grafting and guided bone regeneration. Try and sell that when nobody's ever heard about it.
But it's very visual, isn't it? It's very visual. Yeah. When you talk about changing vertical dimension, for the layperson to understand it, you have to show them a picture. Your point about plastic surgery is critical. Very similar path. I worked with a wonderful plastic surgeon, Oren Tepper, who was...
I know him. Great guy.
And Oren was part of the Montefiore team who separated the conjoint twins, and he's a reconstructive and aesthetic plastic surgeon. But we created this protocol of moving the lip and 3D modeling it with the incisal edge position of the teeth, which impacts vertical dimension, very similar to what you're talking about. But your point is so well taken that the consumer, you can't explain the medical side, but you have to show them visually that whole discussion, which makes it so interesting about going to the consumer with a TV show. So tell us what happened. It's so brilliant. So early.
I, as a dentist, was the unofficial executive producer of the show. I never got the credits for it, but it was my idea and my concept. So I had to create a master team. And you can find it online on YouTube. It was called in Portuguese, Doctor, I Need Help. And now this is when people actually watched television. And I would say about 8 million people watched my show. And it was a Saturday night primetime TV show after the nighttime news. And here comes this young dentist, changing people's lives, but starting with the mouth. John, this is 2005.
Unbelievable.
And I on TV, I'm doing handcrafted smile design, using words smile design. Prior to doing the preps, we had no digital technology back then. This is all on film. It's public record. So focusing on restoring, the rule was very simple. Biology, absence of infection, systemic wellness, function, aesthetics. Because the premise back then was people wanted aesthetics first, function, screw the biology. So I wanted to educate above and beyond everything. I wanted to educate because I knew that I had this position of absolute authority and responsibility to educate. And my mission was to educate the importance and impact of well-done dentistry. I'd really studied hard for this, and I wanted to share that with everybody. Long story short, my practice exploded overnight. I mean, I'm talking 2,000 patients on a waiting list. It was viewed in Angola in Africa, which was one of our former colonies. And very oil rich and diamond rich, a very wealthy nation. And so you have no idea. My practice and this is before, this is 2006, 7, and 8, before social media, right? And we were making millions. And as a prosthodontist, I had to then select between people that came in and said, look, I've got 20 problems, but I can only afford one, versus I've got 20 problems and I can afford everything. Guess which one I would choose with a limited amount of time. And that was the foundation of my no half smiles treatment philosophy, which was founded on biology, function, all function. 14 upper, 14 occlusion in vertical dimension. Now that can be with overdentures, with an all on X, that can be with veneers, onlays, crowns, or on natural teeth, but occlusion-driven aesthetics, because I studied with David Holmbrook in Chicago in 2005, and I learned about occlusion, and that has been the foundation of everything. Good biology, good occlusion, everything else falls into place.
All right, so let me hit pause for a second. Okay, so for everybody listening to this, Miguel's talking a lot of dental conversation here, but if you think about diagnostics, it breaks down into all these categories. We start with aesthetics, and then we go into structure, function, and biology as a specialist, which takes us to this conversation of multi-specialty dentistry, which takes us into this conversation, Miguel, of excellence, because you have been a proponent of outcome assessment, of excellence in dentistry versus poorly done dentistry.
And just to jump in there, you see that in construction, architecture before engineering. Everybody, can go to the local warehouse and buy stuff and build a house, but it's not going to be a very good house. So
with a leaky foundation.
Architecture first. And our friend Christian Coach with the DST, that's architecture.
Right.
So dentists have forgotten that they have to be designers first. I mean, you're one of the best in the world at this, right? So designing is very, very important before engineering. And then that's not even construction. Engineering dictates the longevity of your case. And you're completely right in what you're saying, is that I just think that, and to bring it looking back, because the consumer doesn't understand the importance of full mouth dentistry. And I have a slide I give in my lectures, which is I say, what kind of a dentist are you? Yeah, I'm a cosmetic dentist, I'm an orthodontist, I'm a perio. None of that matters to me. I mean, it's nice, but I think there's only two types of dentists: single tooth dentist and full mouth dentist.
Yeah.
Now, a single tooth dentist is a one at a time transaction dentist. It's like, and they're very needed. They're very important part of our community and ecosystem. These guys will see 15, 20 patients a day and, do one treatment at a time. They're not there. I would liken them to a good gardener. But then you've got the landscape architect that looks at sustainability of the entire ecosystem, looking under the hood, looking at the bone, the ecosystem, the health. And that's what you are. That's what I am.
We are completely aligned on that. We all have our mentors. My mentor was Pete Dawson, my colleague Frank Spear, John Coys, these amazing teachers in the United States. Pete Dawson, 40 years ago, came up with the whole idea of complete dentistry, a comprehensive care. He's really the father of a lot of this thinking for many of the people that we're talking about that has impacted. So for everybody listening out there, this business model of multi-specialty under one roof, where you have this collaborative approach of periodontics, orthodontics, prosthodontics, aesthetics, driven by the designer. The reason that our friend Christian Coachman has really hit the nail on the head is that the smile is designed from a facial aesthetic standpoint. Immediately, you're going to develop the proper vertical dimension, the proper display, the proper paralleling curves of the smile right from the beginning. And we work backwards. And here's the expression: we reverse engineer. Where you're talking about, you were about to say that.
But there's a problem in that system.
Yeah, yeah.
And let me ask you a question. Or when you look at an amazing building, do you talk about the architect or the builder? The architect.
The architect.
The architect is the one that gets the fame, all right?
Exactly.
Now, what I'm trying to say is, how many architectural designs are done yearly at a good firm that do not transform into brick and mortar?
Mm.
I would say 80%.
Mm.
Why? Because the client's like, I love the design, I can't afford the build.
Yeah, yeah.
What you've done is so I understand it, I get it. How much? Whoa. And that is the problem. And I don't mean any disrespect here because, I mean, God, money is hard to come by. But there's so many people that want a champagne smile on a beer budget. And what's happening there is that depending on the doctor's moral compass, ethical boundaries, and position in life, and oversight and due diligence and control, you might have a lot of people engaging in over-treatment, under-treatment. Our friend Riccardo Mitrani at Spear published a recent article on that. And we also have to talk about a lot of bad actors in our profession, and we'll leave that for later, because if we're going to talk about longevity, we're going to have to look at the elephant in the room. But I think that, you know, it's the ideal scenario for any dentist that practices full mouth dentistry is that a patient has the funds to do what is needed. Yeah. What is needed. And I'm not talking about cosmetic. I'm not talking about cosmetic dentistry. I'm not talking about someone that says, oh, I'm going to buy my third Lamborghini and I'm going to have, no, I'm talking about folk that don't have money to make ends meet, that need health in their mouths, and they go to the right place. They can't afford it.
But Miguel, stay right there, because I practice in New York City and I have been into education and teaching because I never want these young dentists to become these so-called, quote unquote, cosmetic dentists, because immediately it means that I'm not focused, or potentially not focused, on these incredibly important elements of structure, function, and biology. So you have to really move slow to go fast in diagnostics. If you take an approach that Pete Dawson talked about, we identify the problem and we do all this data collection. An early adopter like you that brought CBCT and intraoral scans and all of this kind of new technology and digital x-ray into the data collection right up from front makes it easier to diagnose, because you have all that data to then visualize the solution. Where you're talking is, let's go choose the appropriate technique. Today, we call the appropriate technique minimally invasive dentistry. We talk about being conservative in our approach. And once you can visualize, there are many ways to skin the cat, as we know, instead of doing maybe expensive, but less expensive, but will take people to a place of health. Today, we have airway, CBCT, salivary diagnostics, periodontal probing on a computer, on and on, but all of these technologies, right, that allows us to be great diagnostic clinicians, dental detectives, we call it.
I like that one.
Yeah, that'll do that. But Miguel, let's go where you are today, because all of this, your background, really informs where we want to see our profession, where we want to see, we got to break down those walls from 1840. And you know the old story about the grand rebuke when the first medical school said, hey, you dentists, go open up your own school. But let's talk about where you are today on your development.
That what you just said defines where I decided to stand up and say enough
is enough.
About 6 years ago.
Yes.
I have best friends of mine that say, Miguel, yeah, you're not a doctor, you're just a dentist. The Hangover. Oh yeah, let me know, you're not the movie. You're not a doctor, you're just a dentist.
Yeah, sure.
And I just said, you know what? I'll take that. I'm not a doctor, I'm just a dentist. I'm a good dentist, but I'm just a dentist. And you know, when you practice full mouth, proper, good dentistry, you know how deeply transformative that is. Not just a beautiful smile, but if you've got a patient that has systemic health issues and, let's say the patient is 65 years old, is going through cancer treatment, and they've had a family dentist for 50 years or whatever, and now they come and they've got 10 root canals, old metal bridges, all of this stuff in their mouths, and it's by no fault of the dentist. It was just done with an outdated technique some materials that we don't use anymore that now we know we shouldn't have. And the treatments have, reached their shelf life.
Yeah.
And data will show that some treatments average 15. You got patients with the stuff in their mouth for 30, 40 years.
Yeah.
And the microbiome is nuclear toxic, and you get that out of the mouth and you see their immune system just kick in. And I'm like, whoa. So I believe that division of doctors and dentists, it's kind of like this happened 200 years ago. They said, all right, you guys have that, and you can do whatever you want, and let's never talk again. But you're not doctors, okay? And just never talk again. What are the knockoff effects of that over 200 years? You don't have dentistry in hospitals. Doctors know nothing about teeth. MD Anderson, the world's most famous cancer center on earth, finishes at ENT, ear, nose, throat. Know nothing about dentistry. Won't have a panoramic x-ray. Won't. They'll then refer that to dentists. Why are we not speaking to each other? Why does Joe Biden's moonshot, all those billions spent, not have one dentist on the panel? You should be on that panel, Johnson and Levine. What I'm trying to say is that what's going on here? Why are we not communicating? According to the Lancet, in 2020, there were 22 million new cases of cancer worldwide. And according to Oxford University, 1 in every 10 patients has an autoimmune disease that is inflammatory by nature. A recent article showed that over 24 non-communicable diseases that are not contagious have origin in the mouth. And here we are talking about gum disease. That's entry-level stuff. That's a tip of the iceberg. We need to look at the elephant in the room. And that comes from the fact that doctors and dentists aren't communicating. So 100 years ago, doctors got x-rays, dentists got x-rays. 100 years later, doctors got all MRIs, CBCTs, and doctors still have x-rays. What else? A GP trying to figure out what is wrong with his patient can prescribe an MRI, a blood panel. They can prescribe all of these tests and expect to get a report generated. But going to the dentist is a suggestion. You should visit your dentist. And when a month later they get all of the report, what did your dentist say? Nothing hurts, everything's okay. Not based on what? Clinical observation? A film x-ray from the 1920s? What? Did he use a CT?
Okay, wait. I got to hit your pause. You're hitting so many great points.
It's crazy.
And your conversation, this is why we started this podcast. And this is why I'm so passionate about it. We say we have to break down the walls between medicine and dentistry. We say we have to have a health record that integrates care between medicine and dentistry. 58 systemic inflammatory diseases of the body is directly linked to the health of the mouth, as you know. This is 20 years ago. Time magazine, David Satcher, 20 plus years ago, the silent killer periodontal disease. Today, post-COVID, we know what happened with cytokine storms when we have inflammation anywhere in the body, the mouth or anywhere in the body. We have an crazed immune response system. People with periodontal disease had a 5 times greater chance of ending up on a ventilator and passing away. So
but let's only focus on aesthetics.
Exactly. So you and I, for the listening audience out there, what we're going to be very focused on, and Miguel and I are raising the red flag, and we're saying, let's break down the walls. And what's going to happen is the technology that we have, the digital technology that now we can share on a common health platform. So you have Epic for medicine and Pacific Dental with Steve Thorne, God bless, put the energy and the capital in to combining dental records and, in fact, creating medical dental offices under one roof. That's the integrated care that we all want to see. So, Miguel, let's go forward. Let's talk about, and let's close it up with your conversation about how does oral health involve with longevity. You're part of a fantastic meeting that's going on in Portugal. I'm going to try to make it over there. I want to come visit you. Tell us a little bit about what your thinking is, what you're going to be doing in the United States with bringing the oral health conversation to systemic health. Unfortunately, there is none of this education in the dental schools yet in the United States. And you are a pioneer in creating awareness to our profession about what this is all about. Tell us what the most passionate thing you're working on now with that.
I call it missing link. It is it's the brand. It's an artificial intelligence. And I believe that due to this absolute separation of healthcare, medicine, and dentistry, and the lack of communication, doctors don't know how to speak to dentists. And I am exhausted and tired and saddened, and I feel bad for it that I have so many patients with cancer, women with breast cancer, guys, they're scared of dying and they're going through chemo and radio, and they come to me by luck. We take a CBCT and they're riddled with cysts around old, treatments that they have in their mouth, leftover things in their jawbone. And I'll just ask you a very quick question for our listeners. Imagine an orthopedic surgeon. That's a bone surgeon. Orthopedic surgeons work in a hospital setting. Everything's sterilized. They scrub their hands. They go in, and everything is sterilized because nothing can contaminate bone marrow during a bone surgery. And they close it up and they put bandages, and you can't touch it for 7. But we can take a tooth out with gloves from the box with all that saliva. Isn't the bone the same on the same person? Why are we not looking into this? Right. Now, dentists know that you should set up a dental dam or rubber dam for 100 years.
Yes.
To do a root canal, to stop the saliva that has over 400 pathogens, including fungus, to go down the canal because it seeps through the tooth into the bone marrow. So a tooth infection, by definition, is a bone marrow infection. It is no longer dentistry, it's immunology, period. We have to stop using the wrong words. We have to stop expecting magically that there's a frontier between the tooth and the bone marrow. Now, also I'll argue that a root canal is neurosurgery because you're taking out a nerve. Okay? We have to just use the words. Aren't we changing language to appease everybody around the world? Aren't we changing the way we say things? Well, maybe we should change the wording in dentistry. So a tooth extraction, the number one surgery on earth, elective surgery on the planet today, I would argue, is a wisdom tooth extraction. All right? We're taking millions out. It is by default bone marrow surgery in the skull of young adults that will inevitably be penetrated with the saliva that has all of these, this biome, and it's trapped there. Now, let's say your immune system gets rid of it, but what if you have an immune issue? What if you have an autoimmune disease? Maybe you can't clear it. And who's there to help our patients figure that out? So, when COVID hit, we learned about cytokine storms and comorbidities. And those comorbidities are cytokines. They're inflammatory markers. Call them smoke signals that your body produces to ask for help. Well, they're also produced in the mouth. And we're never looking at them because no dentist does a blood panel before a surgery. I can tell you, John, we've been testing 100% of our patients for vitamin D deficiency prior to a tooth extraction, gum disease, perio treatments, or implant surgery for 5 years now. 80% of the people are low. Studies will show that 34% of Europeans are deficient and 13% are severely deficient on vitamin D, which is fundamental for healthy bone remodeling. So, this is the foundation of longevity. It's no chronic inflammation in your body, period. Okay?
Let's stop right there. No chronic inflammation in your body. And so what you're talking about, if I could recap, is you're saying let's elevate the dialogue, elevate the conversation within our profession of dentistry.
Yes, sir.
Let's elevate the conversation between dentistry and medicine. Let's adopt basic medical principles in dentistry, and let's
the language
of how you talk about it.
Yes, sir.
If we just did that, that would be the beginning of this necessary revolution to make people healthier, because people go to the dentist more than they go to their doctor. So, in our foundation, Miguel, in our Glow Good Foundation, it's all about bringing medical dental to underserved population. Miguel is part of the senior dental leadership. We came into that group together. That's right. It was pretty amazing. But it's all about people caring about the inequality that exists. And there in the Glow Good Foundation that we have Lenny Kravitz in the Bahamas, we do medical baseline. We have nurse practitioners and doctors there working side by side with the dental specialists. Isn't that what we're talking about? We're talking about an integrated health care model as the future business model of healthcare.
And I think you hit it on the nail there. The importance of appropriate language. A tooth extraction, that is half of the equation. The right thing to say is tooth extraction and bone marrow cleansing, because when you take the tooth out, what's left? What's that hole? That hole is bone marrow.
It's a portal of entry for your point of the full microbiome.
And nobody's arguing this point.
Right.
So, and we know the pathogen. So I would argue that maybe we shouldn't be extracting teeth in the first place. But since we've been doing it for 1,000 years successfully, define successfully. Is successfully that the pain goes away and the gum heals? Or is successfully the total absence of low-grade chronic inflammation and or infection inside the bone? And if all orthopedic surgeons are afforded the luxury of a surgical field and no contamination in the bone, should dentists not be thinking that way too? And since we cannot, should not immunologists, because that's the language that connects dentists to doctors. It's inflammation. It's immunology, not aesthetics, it's immunology.
Exactly right. And let's wrap with that, because there are steps that we could be taking in dentistry, like your diagnostics of your blood panel and understanding what is because everybody's different. What are your blood levels of vitamin D? What is your immune response level at? Now we can be testing that. What is a practical approach before every surgery, and what are the things we can do post-surgically to ensure proper healing? And is there an overtreatment of wisdom teeth? To your point, it's not eliminating all of wisdom teeth, but a lot of times there's an overuse and an abuse of it. On and on and on with this. Miguel, how long could we talk about this? We could keep going for hours and hours on this.
I just want to jump in with one thing. A team of super advanced artificial intelligence engineers backed by a very generous investor and my co-founder, we created Missing Link AI. So you can visit it at www.missinglinkai.com. And it's the world's only artificial intelligence that is not for dentists. So the dental community don't need this. And what it does, it will help GPs and physicians and doctors and cancer experts and immunologists to prescribe this scanning. It's a screening of a panoramic X-ray, and soon to be released in the second quarter of the year for FMX and for the US market, because we don't do FMX in Europe. But for the panoramic, and what it does is it will scan that X-ray looking for potential hotspots of inflammation and say, you know what? There's something there. Go to a good periodontist, a good oral surgeon, a good GP, well-trained, get a CT scan and a proper diagnosis, and perhaps life-saving, if not life-improving.
So that becomes a basic test of the primary care physician,
yes, sir,
general practitioner. And it's absolutely brilliant idea to connect the dots.
It's pennies on the dollar. It's super specific. We look for 7 things. It's incredibly accurate. And it's super easy to do. So I'd love your help to help me get
I would love to help you create awareness of this and bring this to the United States. There's some projects I'm working on, Miguel. This is so perfect.
We'll bring you on board.
We're going to talk about Miguel, is there anything else you want to tell the listeners? How can they learn more about you, your website? Could you tell everybody?
All right, so my Instagram is at Dr. Miguel Stanley, at Dr. Miguel Stanley, and you have the links to all of my websites, which are miguelstanley.com, whiteclinic.pt for Portugal, whiteclinic.pt for Portugal, and missinglinkai.com for the Missing Link. And it's online in America right now. And if you have a panoramic X-ray right now, as you go, if you have a panoramic on your laptop, you can pay, I think it's $50, and get your screening done today and hopefully get ahead of your health concerns, because there's a lot of hidden inflammation in the mouths of our patients around the world.
We will have that in our show notes. We will have a lot of these learnings that we've been talking about. Miguel, it's been amazing, amazing, amazing to have you on our Think Oral Health
the best, John.
podcast. Great to have you on. Your energy's amazing. Keep the energy going, and hopefully I hope to see you soon.
Thank you, my friend. Thank you for listening, everyone. Bye-bye.
Bye-bye now.